When a patient's condition has become life-altering and the plan for cure is no longer the best option, it is important to understand when to take a different approach towards doing what is best for the patient. The focus turns from cure to care, and this is the time when the medical team meets with the family and those involved in the patient's well-being to further discuss options of palliative and/or hospice care. When a decision is made, the case is handed to the care team that consists of the chaplain, nurse, doctor, and support group. The end of life is never easy, but being ready will help alleviate some issues associated with this matter. After watching this presentation, you will be able to define palliative and hospice care, understand how this care is implemented, be able to evaluate the process of hospice care, understand the significance of palliative care at the end of life, and distinguish the dilemmas that are presented in this stage of life.
Palliative care focuses on the management of symptoms and maximizing quality of life while living with an illness. Patients that are living with a serious or chronic illness can benefit from the approach of palliative care. Palliative care is an approach to the treatment of patients which minimizes their current symptoms. This approach can be implemented when the patient is first diagnosed and can continue throughout the illness. Hospice is minimizing the symptoms and providing comfort to patients after their treatment plans have been exhausted. Hospice is commonly thought to only be for elderly, but patients of all ages are eligible for hospice or palliative care.
The process of starting hospice begins the same way despite if a patient is at a hospital, a home care, or at their own personal home. The first step is usually when a patient is diagnosed with an illness or had a sudden fall or begin with a new diagnosis. They will see their primary doctor, and the primary doctor will determine if they need to have a hospice evaluation. After that, the patient or the POA, which is the power of attorney, or any other family members who have the legal right to agree or disagree with having hospice care. Once hospice is agreed upon, the family members and everyone who can make a decision will decide on which hospice to go with. Then the doctor's referral will go to them. A hospice coordinator will come in, make an assessment with the patient, and determine if they meet the needs for hospice. Once that has been completed, a date will be set for the hospice to come in, be reassessed, and ensure that this is what they wish for, and then hospice will begin.
How does palliative care handle the end of life for patients, and what kinds of ethical dilemmas are presented in this stage of life? The goal of palliative care is to prevent, treat, and prepare the patient for symptoms of terminal disease. As the end of life draws near, the patient experiences pain, psychosocial fears, and the need for spiritual support. It is up to the palliative care team to address these situations and ease the process of death for the patient and for the family members involved. A patient in palliative care may experience chronic pain, dyspnea or shortness of breath, and restlessness. The care team eases these symptoms through the use of analgesics, benzodiazepines, and opioids. To address the psychosocial fears, an assessment is made on each patient to establish different coping styles or spiritual resources. Giving the patients a sense of control helps them to confront death and gives them and their families peace of mind during bereavement. According to Ethics in Palliative Care by Mohanty, factors commonly found in the palliative care process that are essential to ethical and medical values include patient autonomy, beneficence, non-maleficence, and justice. Autonomy is the right to choose or refuse treatment. Beneficence is the doctor acting in the best interest of the patient, non-maleficence, or do no harm, and lastly, justice, which is equally distributed health services. Ethical violations occur when these medical values are not met or disregarded. To avoid ethical dilemmas that arise from palliative care, it is important to communicate effectively. Open-ended questions give palliative care team a good idea of what the patient wants and thereby empowers the patient to make decisions for themselves. Ultimately, the goal of palliative care is to improve the quality of life for the patient and for the family members involved. When effective communication is used, ethical issues are avoided, and the process of palliative care continues to support those who are affected. The end of life is never easy, but having an efficient team to help you through the stages of death is what palliative care is all about.